Cancer is not one disease. It is the general name given to separate diseases that are related, but are different in the way they grow and spread. Cancer can start any place in the body. In all cancers, cells divide, grow out of control, crowd out normal cells, and cause a malignant growth. There's a higher risk of cancer in certain segments of the population. These disparities can be caused by genetic predisposition, such as a family history, individual factors, such as tobacco smoke, or environmental factors including radiation exposure. For instance, smokers are more likely to develop lung cancer than non-smokers. Your genetic code plays a part in your predisposition for the disease. A family history puts you at greater risk. Cancer screenings are tests to detect the disease before any signs develop. Some routine screenings might include blood tests, skin, or a physical exam. If cancer is detected, treatment options might include surgery, chemotherapy, radiation, and immunotherapy. Some types of cancer are chronic, which means that you'll have it for the rest of your life. In many cases, cancer survivors can beat the disease and live a full life after they enter remission. There are many misconceptions about cancer. The truth is that it is treatable and your outcome is better when it's detected early. Making healthy lifestyle choices and reducing risky behaviors can dramatically decrease your chance of developing the disease. The most common types of cancer that affect men are prostate, colon, lung, and skin cancers. The good news is that many of these cancers can be detected early when they are more easily treatable. There are also lifestyle changes you can employ now to reduce your risk of developing these cancers. Knowing the types of cancers and the behavior that contributes to them will help you take a more proactive role in decreasing your risks. Colon cancer is most often found in men who are age 50 or older. Men with a high risk of colon cancer include those with a family history, men who have had colon cancer previously, those who have polyps in their rectum, and men with an inflammatory bowel disease. Men who are overweight and who have a diet rich in high-fat foods may also be prone to this cancer. Polyps are abnormal tissue growth that can be caused by a number of things. Often, polyps are benign or non-cancerous. However, there is a risk that they can turn cancerous. Prostate cancer is another cancer where the risk group goes up as you age. Most cases occur in those 65 and older. African American men have a higher genetic risk of prostate cancer than those of other races. Lung cancer is the leading cause of cancer incidence and deaths in the United States. While lung cancer is decreasing in the general population, it's prevalent among certain populations, such as men with criminal justice histories, because there are more regular smokers among men who pass through the criminal justice system. This cancer can be prevented simply by not smoking or quitting as soon as possible. With every smoke-free year, you decrease your risk of developing the disease. Secondhand smoke can also be a contributing factor, so it's important to avoid confined spaces with those who are smoking. Skin cancer is one of the most common forms of cancer in the U.S. Those with fair skin are more susceptible to this type of cancer, but it can impact any race or ethnicity. Melanoma is linked to exposure to UV light from the sun. One way to protect yourself is by using sunscreen when outdoors, even during the cooler months. Human Papillomavirus, or HPV, is the most common sexually transmitted infection. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. There are different types of HPV strains. It's estimated that most sexually active people will get some strain of HPV in their lifetime. Certain HPV strains are dangerous to females because it causes virtually all cases of cervical cancer. For men, this can still be a risk factor as it causes oral and throat cancers, placing men at even greater risk if they smoke tobacco or cigarettes. Cancer prevention is the use of actions or habit changes taken to lower the risk of getting cancer. These include increasing access to educational materials, maintaining a healthy lifestyle, access to screening, and taking vaccines that can prevent cancer from developing. Better understanding of the disease will help you make more proactive decisions about your health, reducing risk factors. Cancer is the leading cause of death among all racial and ethnic groups. Access to cancer education and getting screening tests done regularly are approaches that significantly decrease your risk.